Building Admitting Department. Code blue, ground floor, Ethan Building Admitting Department. Code blue, ground floor, Ethan Building Admitting Department.
I have never seen a patient alive with a heart rate at 17.
I mean, a normal pulse is 60 to 70.
Her mouth went to the left. She was gasping, and then her eyes were closed.
When I looked at the rhythm strip, I realized that she was in complete heart block,
which is a complete disorganization of how the heart beats.
The electricity that goes in the areas of the heart to keep it pumping at a fast rate, there were blocks in that pathway.
Third-degree heart block, the worst type of slow heart rate.
Your heart is only pumping a third of what it should be.
The rest of the body's not getting enough blood,
which means their blood pressure falls and they aren't able to perfuse their vital organs. So you start to have organ death.
She had that look like she had one foot in the grave.
The goal in emergency is always to stabilize the patient and then to move them where they need to be.
We knew that right away she needed a pacemaker.
The key objective was to get that heart rate back into or close to a normal range.
And so I knew that I had to act quickly.
Seconds count, and minutes make the difference between living and dying.
I just looked at her and I said, "Stay with me. Stay with me. I'm here."
So we gave her a dose of atropine,
which is a medication to really try to kick the heart rate up.
The first dose of atropine didn't have quite the effect we wanted.
It was frightening.
So the doctors asked us to start dopamine, an inotropic infusion,
which is a drug that we use to increase the blood pressure.
Unfortunately, our heart rate still didn't come up.
With each failure, your anxiety levels go up.
So we decided to go with the transcutaneous pacing.
We brought in one of the heart start machines and we got Vidya connected to the pacer pads.
Transcutaneous pacing is our method for electrically stimulating the heart.
We can just apply it directly to the chest and pace the heart externally.
And we crank up the voltage and we kept increasing the volts, increasing the current.
And she responded, so her heart rate did come up.
Her heart was capturing the rhythm of 60.
We were stabilizing.
That was definitely the turning point.
I mean, she's a fighter. She didn't want to go, and we certainly weren't going to let it happen.
Then the CCU team had arrived. They mentioned that the procedure room in our coronary care unit was ready.
We knew that we could get her up to the cardiology department for a more permanent solution.
So Brad and I went up with her to the coronary care unit with the cardiology residents.
And when we dropped Vidya off, we knew that she was in good hands with our cardiology department.
I think it's miraculous and sort of like slipping off the edge but quickly stepping back.
They were great people. Thanks to each and every one of them.
I'm happy that I survived, and to all those who cared for me, I'm grateful.
We work with a great team here. We've got really great people.
And it was really just inspiring to see how everybody came together.
You know, what I love about emergency medicine is that you never know what walks in the door.
Give them a problem, particularly a life-threatening problem, and I can guarantee you they're going to have an approach to solve that problem.
It's what we're trained to do.
When the big emergencies happen, I want to be in the room.
I just had that positive feeling that things were going to be okay.
This is why we come to work every day.
I love the action. I trained for the action. But every day has its unique challenges.
In the emergency department, there's most certainly some need.
We need up-to-date equipment.
Our telemetry equipment, which is the equipment that monitors people's hearts, is very old.
We need more ultrasound machines.
The biggest gap, I think, is the lack of beds in the emergency department.
We have a lot of patients that are treated in the hallways.
It's hard on the staff, but it's particularly hard on our patients.
Every year the volumes go up, and every year the acuity goes up.
We need a bigger space.
It's essential, and we are in dire need of funding. The funding just has not come.
If you can help us and partner with the hospital and the government to support our program, we can have the emergency department of the future that we dream of.
In the Emerge, we're doing some amazing work. And I think it's time to celebrate success and the global impact that we have at the UHN ER.